and welcome to Nursing Webinar session. Myself, Shanti. Today we are going to discuss about the CKD biomarkers in prevention of kidney diseases beyond creatinine. For this, I know this is going to be a very complex subject, but I think everybody should know a little bit about this. For this, I welcome our expert panelist, Dr. Rajasekara Chakravarthi Garu, who is our Clinical Director and HOD, Nephrology and Transplant Services from Yashoda Hospitals, Hitec City. And we all are privileged and honored to have you with us today.
My privilege. Yeah.
Thank you, sir, for your valuable time. And again, as a speaker, I would wish to welcome Miss Aneesha Nelson, who is also a senior nurse from Transplant ICU. I welcome you, Aneesha, and please share your slide. Yeah, so we would like to first understand from your view is, like, am I audible, sir?
Yes, I can hear you. Yeah.
But can't see you, sir. Then, okay, yes, sir, yes. So first, this is going to be every slide is going to be a learning slide for us. And we would love to listen from you, sir, in a very simple nursing perspective way. So what is the role of biomarkers? I think while preparing the slides, we were just understanding these are all measures are taken for early detection and prevention of kidney diseases. So in simple, understanding, we wish to hear from you for the first, to begin with the slides. Yes.
So it is a very relevant topic for any healthcare worker. Main reason being, in the country now, India has a huge burden of CKD.
Yes.
Most of you may be aware, we have close to 20% of the population which has a CKD. And unfortunately, most of the people who have CKD do not know that they have CKD. And every year, 5 lakh new people reach dialysis stage in our country. When that is the case, it is our duty as a hospital, as a nephrologist, as a nurse, to know a little more about this burden. And is there anything in our hands to delay the progression, reaching dialysis stage, or prevent it fully? So early detection is the most important thing. Once you know somebody has a problem, you label them that they have CKD, you can give them a list of do's and don'ts, and you can give some medications to delay the progression of CKD. So the relevance of today's topic is the huge burden of the CKD in the country. Early detection is possible if you know a little more. Third, you can also delay the progression by doing a list of things. And to do all this, you need a indicator which will tell you that this particular person has CKD. So a biomarker like a blood test or a urine test, which will tell you that there is a problem with this patient, is extremely important.
So very productive key points you have conveyed to us, and let us see what we have in the rest of the session. Over to you, Aneesha. Would you like to start?
Good afternoon, everyone. I'm Aneesha Nelson, working as a staff nurse at Kidney Transplant Unit. As we are learning about CKD biomarker, let's first understand the meaning of biomarkers. What is biomarkers? Biomarkers are measurable indicators of a biological state, such as disease. These indicators can be found in biological samples, such as blood, urine, or tissue. So, let's see what is kidney disease biomarkers mean. A kidney disease biomarkers is a substance that can be measured to assess kidney function and health, diagnose, evaluate, and treat kidney disease. Biomarkers can be proteins, lipids, microRNAs, genes, metabolites, or cells found in a urine sample.
So here, sir, if we understand, like, now, Aneesha was going through all these points, like biomarkers can be found, like proteins, lipids. And when we talk about genes, sir, what we understand is anybody who has a family history of kidney disease, will also, label as a genetic biomarker, and they'll have to go for this biomarker test, sir?
Yes. So to look it little broader,
Yes.
we always look at in whom should you do the biomarker. So we have a list of people called at risk for CKD.
Yes.
First of all, every diabetic. Second, every hypertensive. Third, those who have a patient in the family who has CKD. So there are quite a few kidney diseases which run in the families, what we call as familial kidney diseases. So it is
Yes.
good to know if one person in the family has a kidney disease, all the family members once in a year, you do the biomarker in them so that you pick them up very early, even before they have the disease. This could be a genetic marker, or this could be even a level of serum creatinine or urine protein. You just do in them because they are at risk.
Yes.
The other three categories are those who have stone disease, those patients who take medicines long term for any reason. It could be NSAIDs, antibiotic, or proton pump inhibitors. Then those patients who are very obese, they are also prone for what we call as obesity related kidney disease.
Kidney disease.
And finally, those patients who have recurrent urinary tract infections. So these 6 categories, we call them as at risk, and we do a biomarker in them every year once, so that we know these patients have the disease or not. If they have the disease, we pick it up early and we are able to delay the progression.
So, sir, what is the trend? Do the family members or common community or people, they opt out for this test? Do they come and seek your advice?
So the type of familial disease, there are quite a few diseases both in children and adults who
Yes.
have genetic kidney disease. For example, Alport's is one. You will pick it up in younger individuals who have protein loss. So depending on the reason the patient had a kidney disease, you can do a specific genetic test. You can look for Alport's, you can look for cystinosis, you can look for xanthinuria, oxalosis. All of them are familial diseases which you can do a simple genetic test today. Even 5 years back, these tests were not available.
Yes.
Now they are available.
Yes. Yes, Aneesha.
So let's now understand the importance of biomarkers. Biomarkers play a crucial role in early disease detection and damage like kidney disease, identify individual at risk, monitor and treatment progress, and guide the treatment decision.
So, sir, is this few key importance of biomarkers we have mentioned, like as you also have said, early disease detection, and are these statement right, sir? Content which we have mentioned here.
Yes, the most important thing is early detection.
Yes.
But as Aneesha has told you, once you detect, you are able to give them a list of do's and don'ts, including certain medication to delay the onset or prevent the onset. So you can periodically recheck whether this person is successfully avoided getting CKD. So you will have to have some sort of a monitoring for them. So it will be helpful both in early detection, also prognosticate what is happening in that particular individual.
So we call it as a little personalized care they receive, no, sir? Like
Yes.
that. Yes.
It's called precision treatment now.
Precision treatment. Yes, sir. Yeah. I think we have already discussed the group of diseases. You can go to the next slide after the group, the risk group.
Yeah, ma'am. Let me explain who are the high-risk groups. First of all, already sir explained diabetic patient, hypertensive patient, patient with a family history of kidney disease, obese patient, patient with cardiovascular disease, patient with autoimmune disorders, etc.
Yeah, you can go to the next slide. We have already discussed about this high-risk group.
Yes, ma'am. Then here few examples for conventional biomarkers. First of all, GFR and albuminuria and proteinuria, glomerular filtration rate, it measures the kidney's filtration rate, indicating how well the kidneys are working. Then albuminuria, proteinuria indicates the presence of protein or albumin in the urine, a sign of kidney damage.
Yes, you can read this as well, and then we go forward.
Blood urea and nitrogen, we'll call it as BUN, measures waste build up in the blood.
Sir, again, like a traditional or conventional method of these biomarkers, like these are these limited when the patient walks in with the early symptoms of kidney disease? Are these tests not sole enough to detect the kidney disease, or should we go for the advancement as well?
I think it depends on why you are doing it. You want to know what is happening after treatment, or you want to detect early. To detect early, GFR estimated and urine protein are the two important things. Whereas at the end of 3 months or 6 months of treatment, you may want to do another set of them to know what is happening or the response to the treatment.
Let's now we'll go through role of novel emerging biomarkers. For cysteine C, neutrophilin gelatinase associated with lipocalin, kidney injury molecule 1, and interleukin 18. So cysteine C, a protein that elevate in response to kidney damage, measures kidney function, less affected by age, sex, muscle, and muscle mass, can be used to estimate glomerular filtration rate. So next one is neutrophilin gelatinase associated with lipocalin. So a protein that is elevate in response to kidney damage. So kidney injury molecule 1, it detects kidney damage, particularly in proximal tubule injury. Interleukin 18, a cytokine
Cytokine response.
Cytokine that's elevate in response to damage and can predict the severity of AKA.
So, sir, again, this is a very high subject for us, and then we would like to understand in simple terms, like this novel emerging biomarkers is a new advancement or existing, which we may not know, but then your insight would be, able to clear our doubts about it when we should do, and all these tests to be done, as you were mentioning, like early detection is a key.
So the list that Aneesha has given us now are 4 in front of you.
Yes, sir.
Cystatin C is superior to serum creatinine, and therefore there are units which use cystatin C. Yes. This is for both acute and chronic situations. Yes. It is supposed to be more reliable and more robust marker of change in creatinine, change in kidney function than creatinine. Yes. But all the other 3, NGAL, KIM1 and interleukin 18 are mostly for acute, not for chronic. And out of these 2-3, NGAL and interleukin 18, both are patented by Indians. Dr. Prasad Devarajan has done a lot of work for NGAL and Chirag Parikh for interleukin 18. So they are the 2 people who have patent for these 2. And in India, NGAL is available for routine usage, but it is not a CKD marker per se. It is a AKI marker. AKI. Whereas cystatin C has a role for both AKI and CKD, both it has.
Yes. So, sir, now we are just progressing towards the end of the discussion. Share the slide, and when we, sir, what is like when we talk about the patient's perceptions, it varies because they simply just do not opt out all this. After a lot of counseling, they opt out this. So, do they understand this testing process, sir, and how do they accept and how do they cope up, sir?
So, my own understanding is whenever you order a test, you have to explain to the patient why you are asking for it and how does it change your management. Once you convey, 90% of patients are happy to do it because you have told them and they understand why it is being done. So acceptance is usually not a problem. You must be aware now We do a lot of PET scans in Yashoda Hitec.
Yes,
Now, that used to be a very rare test in the past. But now, every day, I think there are so many PETs done, though it is expensive. And why they accept it is you tell them the reason you are doing it and how it can change your management. So I think communication from the nursing team and the doctor needs to be a little more clear in conveying why and how it affects the management.
Yes. So now towards the last slide, we would like to have a very key message from your end. What is your key message to the nursing fraternity? What they should also now look into?
So I'm sure most of you by now know the most important message that we are trying to convey through this discussion is India has a huge burden of kidney disease. Unfortunately, most of them do not know that they have a problem.
Yes.
At this point in time, if each one of us starts talking about it, makes a little more noise, people who are at risk, the 6 categories that we have discussed, we have to get them to have an annual checkup of a marker. It could be EGFR, urine protein. Pick it up early so that most of the kidney diseases, when you pick them up early, you can avoid further deterioration in the kidney function. And in some instances, totally prevent a kidney disease from progressing. Thank you very much.
Thank you, sir. And that was very valuable and very productive discussion in very simple terms. You have explained to us, sir. Thank you. And we request all the learners and viewers to just refer our health talk page by browsing on the health website of Yashoda. You will get many more insight which is dealt and spoken by Sir Dr. Rajasekara Garu. And with this, we end the discussion. Thank you, sir, and thank you, Aneesha.
Thank you.
Thank you, sir.